Everything we do is about family. We have 5 kids altogether, 2 adults, 3 still young in school age. Everyone is very close to each other. My siblings and I, our kids are all around the same age. We're always together. My mom always says there's never a dull moment. There's always something going on. I have something on my fridge that says, you call it chaos, I call it life. That's just the way our life is, and I love every minute of it.
So in the fall of 2017, when I started noticing a decline in her energy level, she was starting to get a lot of stomach tenderness, and it was starting to get bigger. She looked 9 months pregnant. She's like, well, it's just another hernia, because that's what we thought she probably had. She had had 2 hernia surgeries prior to that, probably within a year prior to that. New Year's Eve came. We did our traditional New Year's Eve, stayed home with the kids. New Year's Day, she was hurt. She couldn't get out of bed all New Year's Day. And at that point, I put my foot down and said, we're going to the hospital.
So on January 1st, around midnight, my husband took me to the closest hospital in our area, just thinking that it had something to do with my hernia. Never did I think it would be anything more than that.
They just told me that I'm gonna die. They just gave me my death sentence. And just like that, I remember all these things started running through my head. People I had known in the past that had cancer and how it affected them. And my kids, obviously. Who was gonna take care of them? Who was gonna raise them? I had so much still to teach them that there's no way that I was gonna walk out. And I was not going to let anyone else tell me that this was the end of my story.
At that point, Nikki had a friend that was an oncologist or just graduated into oncology. We called. She recommended Wilmot was the best place to go. We met with Dr. Casulo, who was absolutely the best. She was compassionate, loving. She gave us hope.
So Nikki first had a diagnosis of stage 4 ovarian cancer, and that was based on some imaging or CAT scans that were done when she developed symptoms of abdominal bloating and pain and discomfort. And ultimately, it's when she had a biopsy that showed lymphoma that we discovered that it was not ovarian cancer. Her definitive diagnosis was follicular lymphoma that had transformed into more aggressive lymphoma called diffuse large B-cell lymphoma.
We started with my first round of chemo. The plan was to do a few rounds of chemotherapy, and I would be done within a few months. This seemed like easy peasy, I can do this. My first round of chemo did not go as planned. I got severely sick. About 8 o'clock in the morning, I got up the next day after treatment. I told my husband there's something wrong. I went by ambulance to the hospital and got diagnosed after a while with what's called tumor lysis, which can be fatal.
Tumor lysis syndrome is a scenario where the patient's cancer dies so quickly as a result of chemotherapy that the cancer cells spill their contents into the patient's bloodstream. In fact, in her case, it was so severe that she resulted in the ICU.
Every time we do the chemo, she was in overnight after that point. And, I'd stay up there with her, and the tumor would shrink, and her stomach would get softer, and we'd think, oh, this is great. 2 weeks went by, all of a sudden it's gangbusters, bigger than before.
That's when we were really starting to suspect that things were not going well for her.
So the day came during a treatment. Sorry, this is hard to say. I adored Dr. Casulo, but for her to have to sit with me and tell me this isn't working. So we need to make some serious decisions. I need to know what you're willing to do. It's gonna be tough, but we can try to get you this other treatment. This treatment is called CAR-T. It's really new, but it's not gonna be easy, and there's a lot of side effects. And so I asked her point blank, without it, if I don't get it, what am I looking at? And she said to me, 3 months to a year.
CAR T-cell therapy is a type of immune therapy where we collect T cells from a patient. So these are immune cells that help us fight off viruses and even cancers. And we train those T cells so they can identify the cancer cells and attack the cancer cells, hopefully eradicate them.
I love this idea of my own T cells working on my own body. Who knows my body better than me? The side effects were terrifying. In very rare cases, there would be swelling of the brain, and there would be no coming back from that.
With any new therapy like this, we learn a ton from our patients. On the clinical trials, we've actually adjusted our therapy so that we're intervening on patients much earlier in their disease course to try and decrease the side effects that people experience through this.
The day came, the day before my birthday, actually. I was going to go back into the hospital and get my T cells back. This treatment that was going to save my life was coming. I did my 1-month scan. Dr. Reagan came in, said, "How do you feel?" "Good." It's gone. There's nothing there.
I don't care if I won the lottery 10 times. I wouldn't have been as happy as hearing that.
Anytime your patient is cancer-free after the treatment that you've developed for them, it's such an amazing experience.
My little one, Mia, asked me one time when we were driving, "Mom, were you afraid of missing out on like us having babies or weddings or things like that?" And I said to her, "Of course, honey. I was so afraid of not being there for you guys." But it wasn't the big things as much sometimes. It was the little things I was afraid of missing. And because of my doctors and because of CAR-T, I get all of it. I get the little, I get the big. I get everything back.